Hello, and welcome to Healthcare Matters, where thought leaders come to discuss the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Jonathan Terry. Dr. Terry is a board-certified osteopathic physician and surgeon, as well as a general psychiatrist. Welcome to Healthcare Matters, Dr. Terry.
Thanks so much, Mike. I really appreciate the invitation to be on the show.
One of the greatest challenges in rural communities is access to healthcare. What advantages does telemedicine offer in treating these underserved populations in the United States? Also, Texas, one of the largest states in the country and one of the largest rural communities, recently made it more difficult to practice telemedicine. They no longer allow a doctor-patient relationship unless the patient and doctor meet face-to-face initially. How do you feel about that sort of regulation?
Yeah, Mike, and maybe I'll start with the regulation in Texas, talking about the face-to-face encounter, and specifically what they're looking at there is the presence of a physical exam that should be done at the first visit. And that's something that I know the American Telemedicine Association is looking at actively, as many states do not require this. And it's interesting because if you think about many specialties, think of the radiologist, the pathologist, the dermatologist, so many of these services are being conducted flawlessly without the use of a physical exam already. So I think that this is one of the areas that's very interesting, very innovative in the law that we're seeing right now. My expectation is that eventually what we're going to see as, looking at 2015 with over 200 laws passed in the United States just related to telemedicine, it's such a rapidly evolving field. And so I think we're going to see the pendulum swing a little bit between more conservative thinking and more progressive approaches, especially as we look at our nation's needs for expanding services.
You had mentioned that more than 200 laws were passed in relation to telemedicine last year. What are some of the highlights? What are the great advances, and what are the great hindrances that might have come out of 2015?
2015 was a really neat year, and I think that one of the biggest things that we're seeing is just innovation across the field, Mike. So we're seeing companies that are putting a doctor in people's smartphones, the ability to text message a doctor who could be anywhere. We're seeing opportunities even on the web for companies, for patients to directly communicate with, say, a third-party dermatology service to upload a picture of that scary mole and get an opinion on it. Or maybe you do need to go in and get a biopsy or something, which may not always be the case. The laws lag a little bit behind. The neatest thing, I think the best highlight that we're seeing is that the case laws tend to be overwhelmingly progressive. They tend to be expanding telehealth and looking at ways that how else can we safely use this technology? The incidences that I see of, say, physicians getting in trouble is when sort of the same things that we see them getting in trouble for in person, when they're practicing unsafely or outside of their scope of practice.
Thank you for your time, Dr. Terry.
My pleasure, Mike. Thanks so much for having me on board.
As our viewers understand, medicine is both a business and an art. How does the reimbursement rate, the business side, vary from a telemedicine visit to a traditional doctor's office visit?